Okay, so let's look at the topic for week 6. It's called the nursing career critical thinking. I asked a crowd give 30 minutes. Okay, so they give me 30 pages for PowerPoint. Very good. Okay. And let's look at the topic here. Actually, what I did here is the same path for your final project. Okay, so and this topic is for the week 6 and week 7, because week 7 is a holiday. Okay, and also if the whole world they have a nursing certificate program. They call it N1, N2, N3, and N4. Okay, so next time maybe I will introduce some like a certificate system in Taiwan's hospital. Okay, so but today we just focus on the nursing career critical thinking. And you see, I'm sorry, that's the old one. I think I put the. Let me check out my. I remember I upgrade the PPT, but the content is not correct. Okay, let me check it. And so if it is your final project, you have to check out first. Okay, and let's go by my disk. Right here. Let's see, this one should be correct. Okay, yeah, this one is correct. I'm sorry. And I will change back for the Moodle. Okay, and actually the picture is from the Pixel Bay. It's a you can it's a free, and you don't have to worry about the IP law, intellectual property law. So Pixel Bay I already put down the connection. Website is on week 6. Okay, so let's see the critical thinking in a nursing career and building skills for better care. Okay, better care. And why the critical thinking matters in nursing? Nursing involves a complex, fast-paced decision making. The critical thinking improves patients' outcomes, safety, and the care quality. So for your topic is the final project, just same as I did the lecture here. Okay, so don't worry about it. Okay, so I will teach you how to pick out a picture and how to organize a PPT. Okay, that's a pattern right here, and I pick out by myself. Okay, this one. So that's a good answer for why. Okay, critical thinking. It's the ability to analyze, evaluate, and apply reasoning to solve problems. Okay, that's a good answers for why critical thinking matters in nursing. A nurse deciding whether a patient's symptoms indicate and see like a allergic reaction or an infection. Okay. And first part we will talk about why is the critical thinking in nursing. Okay. The second one, why is essential for career success. Third, how to develop and apply that in practice. Okay. And number 4, real world examples and scenarios. Okay. Let's look at what is the critical thinking in nursing, and you have to understanding the critical thinking. See, I have technique put the small word right here. Understanding the CT, critical thinking. Okay, so involves the observation, analysis, interpretation, and decision making. Okay. Say I'm a director, so I have a lot of time need to make a decision. Sometimes need to decide that for the meeting conclusion. Sometimes it's a teacher's tenure, promotion, that kind of stuff. So if you can, like I say, be sure to do the management job. Okay, in that way. Because we talk about AI versus HI, HI is a human intelligence. If you don't want to replace by the AI, I think a management job is a safety. Okay, safety. Okay, and it's a differs from routine. Okay, task performance, and requires reasoning and judgment. And based on the evidence, not the assumptions. Okay, for example, using the patient data, not just intuition. Okay, based on the data. Intuition means I directly think about that. It's not work. Okay, and 3 processes you need to remember: observation, and analysis, and decision. Okay, and the core components of critical thinking, breaking down. Okay, first, called observation. You are noticing subtle changes, e.g., a patient's breathing pattern. And for analysis, you are connecting symptoms to possible causes. And for evaluation, you have the weighing options, e.g., call a doctor now or monitor. And problem solving, choosing and implementing a solution. And reflection, learn from outcomes to improve future decisions. And see, this is from Pistol Bay. So they have already have a source. So it's a credit to JD A-Wink. Okay, so it's iStock. This is a source already here. Sometimes they have it, sometimes they don't. But for your work, for the final project, maybe you type the source on the bottom. It's from Pistol Bay. Okay, PIXA BAY. Okay, so it's free, and you actually they provide these free pictures for everybody to use it. But for the ethical problem, you have to give a source. Okay, and why critical thinking is essential? Because it will impact on nursing practice. And patient safety prevents errors. For example, catching a medication mismatch. And efficiency prioritizes tasks in higher pressure settings. That's for everybody. Okay, so you need to prioritize. You have to decide it every day which one you have to do first. Okay, otherwise some trivial things. Okay, maybe lay down you have children. I mean, you have to prioritize which things do the first. Okay, otherwise you will affect your efficiency. Okay, and advocacy helps nurses speak up for patients' needs. Very important. Okay, helps nurses speak up. Okay, that's for patients' needs. And career growth. So employers value problem solvers. Okay, and studies show critical thinking reduces hospital errors by up to 30%. very important. Okay, critical thinking is very crucial. Okay, reduce hospital errors up to more than 30%. Okay, and developing the CT skills, how to build this skill. Okay, first ask questions. Why is this happening? What else could it be? Practice scenarios. Use a simulation or case studies. Okay, and seek feedback. Learn from the mentors or peers. Okay, mentors or peers, especially when you up to the practice, there were some elder nurses, right? They will lead you and guide you. That's called the mentors. Okay, and stay curious. So, 像 like research conditions, treatments, and protocols. Okay, and reflect after shifts. Think what went well, what could I improve, and you have to keep a journal to check a decision-making progress. It's like a notebook. Okay, journal. That's a journal right here, notebook, and to track decision-making progress. Okay. And let's give a scenario for chest pain, okay? Real world example for applying. And for example, the patient reports the chest pain, but the vitals are stable, okay? Vitals are stable, but they are anxious, okay? And nurse observes the pain started after eating, no shortness of breath, okay? No shortness of breath. So the critical thinking steps you can apply, the first one is called analyze. Analyze, you have to think about, it could be cardiac, GI, or anxiety related. GI, okay, stomach or intestines, okay, called GI. And evaluate, you can order ECG, but also ask about the diet. For example, maybe the patient took a spicy food, okay? And decide is monitor, report to doctor with the findings, okay? And the outcome turns out to be an acid reflux, okay? Acid reflux. So not a heart attack. So quick thinking saves times, okay? And that's applying the scenario 2 for critical thinking. Called a medication error, okay? Medication error. And the scenario is the nurse notices the patient's dose seems higher compared to their chart, okay? So you can apply the critical thinking steps. Observe first, okay? Double check order and the patient history, okay? And you can analyze by possible typo or wrong patient, okay? Typo means wrong name or wrong record, okay? And you can contact pharmacy or doctor to confirm, to do the evaluation, okay? The outcome prevents overdose, okay? Overdose. So evaluator is very important. You have to contact the pharmacy or doctor to make a confirmation, okay? So the critical thinking saves a life, okay? Sometimes they have if the patient have allergy to some kind of medication, if you didn't check out the records, I mean, maybe the serious in the patient will lose their life, okay? And challenge to critical thinking. You have to overcoming obstacles, okay? Overcoming obstacles. So time pressure, okay? Emergency settings limit the reflection time, okay? So ER, okay? Emergency settings limit the reflection time. So in that time pressure, very short time, you have to make a right decision. It's not easy, okay? So that's the challenges, okay? So there's a lot of obstacles, okay? A lot of obstacles. you have to face it. Okay, fatigue. Okay, long shift down focus. So self-care is the key. Okay, fatigue. Okay, suffer. Okay, BIOS assuming it's always X being everything. Okay, can lead to mistakes. Okay, can lead to mistakes. It is always like this way. It's always, you don't have to worry about it. It's always, this patient is always like this kind of situation. That can lead to mistakes. Okay. So solution, you have practiced the mindfulness and double checking the habits. Right now, in Taiwan, I don't like the education because it's occur my friends because the bad grade, they will ask the children to go to the hospital and to make a evaluation. Three kinds evaluation for like affective. Have you heard about that? Psychomotor, and but normally these children go to the hospital, make an evaluation. They will give a medication, and in the long run, if the children took a lot of medication, it will affect their neural system. So originally these children don't have any problems, but right now in Taiwan, the education, the teachers will ask, like a traditional, they ask children should be quiet, and not disturb my class. So they will use this way: go to the hospital, take a medication, but in the long run, I mean, the brain and the neural system will be affected. Okay, so. And conclusion, okay, takeaways. And critical thinking is a learnable essential skill for nurses. It improves the patient care and boosts your career, okay? And start small, like a question, reflect, and practice daily. Call to action, okay? Next step, pick one situation to analyze critically, okay? Let's see. I ask Krog is for 30 minutes. Let's prove it. Okay. So if you want to finish the oral presentation, press the